Welcome to another episode of the Apex Perspective podcast. Today I have with me Leo Carayannopoulos, who is currently the Chief Executive Officer at Edge Surgical Incorporated. However, Leo is not just a Chief Executive Officer, he's been an entrepreneur of his own company for 14 years, and this was a company in which was Resolution Development Services. So today I have with me a technical executive and an entrepreneur. I'm excited to have him on the podcast. So Leo, can you tell me more about that previous company and what led you to Edge Surgical Incorporated?
Sure. So started my entrepreneurial experience or journey, maybe is the best way to think of it, is coming out of school, went into the military, and then ended up going to Northeastern University, became an engineer by trade, and started off in robotics and also in machine vision. And so those were in the early 90s, back when like a 1K by 1K camera was like this big and it cost $10,000 and so forth. Eventually ended up at Abbott Laboratories, where probably one of the best companies I ever worked for in my entire life. I don't think without the experience that I had at Abbott, I would have been successful doing medical device manufacturing and so forth. Came out of there, and then in 2008, during the Great Recession, got laid off at a small startup. And then I said to myself, I will never let any one company dictate any type of control over my life. And so at that point, me and my business partner at the time, we both put $1,000 in, and within 3-4 years, we were making a company that did contract manufacturing, Class 2, Class 3 medical device product development that ended up doing, well over $10 million per year in annual revenues. And we never took a nickel from anyone. So how did I get to Edge? Well, Edge was actually a client of basically mine. So actually the current depth gauge, which is on the market today, was actually designed by my manufacturers and by my engineers. And when I heard that Edge needed a cash infusion, me and my business partner Matt, we had started a capital venture fund, and so we infused the cash, and then I got so enamored with the product, I decided I was going to run the company myself. And so, so even though I'm the general partner of Actimed, which is a venture capital firm, I'm currently running Edge Surgical probably for the next 24 to 36 months.
Yeah, and Resolution Development Services is, from what I can see so far, you were primarily working the sales side of things of medical products. Is that correct?
Yeah, so Resolution really had two parts to it. Like we were experts in bringing visualization to the operating room. So like what I like to tell people, if basically there's a way to get a camera into your body, we pretty much did it. Some are less pleasant than others. So, some of our claim to fame was putting cameras into the human heart for AFib. So like you could do real-time imaging while basically ablating heart tissue. Obviously catheters, endoscopes, feeding tube systems. Really it's really amazing how many procedures require a fluoroscope confirmation that the device has been deployed to the right body part and so forth.
And Leo, I hate to interrupt you, but a lot of the audience is not particularly specialized in surgery. But can you explain to us why that is so important to have these particular devices during surgery?
So right now, if like you think about it, take like take something as simple as a feeding tube, right? Yeah. There are some people that have absolutely no gag reflex. So when someone is having a tube put down their throat, it is equally likely that the tube is going to the lungs as opposed to the stomach. So so basically the protocol is you deploy the tube, you take an X-ray fluoroscope, you confirm the tube is in the stomach, not in the lungs, because if you put food in the lungs, that happens, right? I mean, obviously that's like that's a big issue. And then, and only then can you actually deploy food so that you can provide nutrients to the patient. Another example is for people that have AFib, which is their heartbeat is not regular, right?
Yeah.
And so the way that they do that is they ablate tissue, which means burning tissue. Okay. There's no way to see how much energy is being deployed to the heart tissue. So if you put too much energy in there, you can actually start to boil the blood. If you don't have a good contact with the tissue, you're putting more energy into the bloodstream as opposed to making good ablation. And so those are all blind. So like there are anecdotal evidence that is being provided to the surgeons to say that I'm doing a good ablation or the tube is in the right place and so forth. Right? When you look at things as endoscopes, anything like a colonoscopy or anything, for throat cancer, stomach, whatever, right now, a lot of it is really old. It's like, you're looking through a eyeglass.
Yeah.
With cameras, you can detect really interesting, areas that might be missed previously because really the surgeon's trying to kind of do this as opposed to looking at the screen and guiding it. So vision and medical devices are going hand in hand, and it's only becoming more and more prominent.
So these are delicate, nuanced operations, and you're essentially connecting in these particular scenarios. You're connecting those pieces of information that are absolutely necessary during operations. Otherwise, really bad consequences will occur essentially. So can you tell me more about the sales side of things? Because I know that that's one of the particular specialties of this company. How do the sales and branding happen behind these medical products?
So it's usually time, right? I mean, sales 101, whenever you're selling anything, you have to establish what your value proposition is, right? What I always tell people is you can only do one thing well. The moment you try to dilute yourself and try to do two or three things, you're guaranteed to fail across the board. So, my approach to sales has always been is know what you're good at. You strive for perfection. You settle for excellence, right? Because perfection is just a concept. You'll never achieve it, right? And then you really have to go out and approach your target audience and really explain to them why you're going to bring something that is so much better than basically your competitor. The way that the sales of Resolution took off, it was really one client at a time. Services is probably the hardest thing to ever sell, right? Because people want you when only they need you, right? And then they will forget about you. And so the thing that made Resolution a powerhouse was we were able to deliver the best when it came to visualization and medical devices. And so we never really strayed from that. And so,
especially in a particular niche.
Yeah, right. And, and I think that holds true for almost any product. I mean, I would say that is kind of true for Edge Surgical today, right? We are developing, the best depth gauge. We are in the process of rebranding. We'll be launching our new website within the next 14 days. But what I tell people is Edge Surgical, we have perfected the depth gauge. We have the best depth gauge by far for the orthopedic plate and screw market, second to none, right? And our customers are seeing it every single day. And the early adopters, the surgeons that are using it are loving it. And now that we'll be launching the 40 millimeter and the 120 millimeter depth gauge, we can address the entire orthopedic plate and screw market.
And I want to get into that, absolutely the value that it provides. I want to zoom out really quick. You've been in the medical space for over 20 years. What compelled you towards the space? What compelled you towards this space in the first place?
I think it was actually opportunistic. Back when I was in the machine vision and also in the robotic space, at that point I had just got married. I was surrounded by all these brilliant engineers, a hell of a lot smarter than me. They're all out of MIT. And, but like it didn't pay very well. Right. And so, after the birth of my first son, I have 4 kids. So when George was born, my basically at that point it was like my wife said to me, "I know you're having a good time, but at some point you got to go make some money." And
Okay.
so, I was very blessed because I was trained by these amazing technologists, right? I mean, from mechanical, hardware, vision, optics. And so then I was very fortunate when I did decide to go out into the market. I think I had like 6 job offers, right? I had,
Okay.
Abbott Labs, there was Eden, I don't know, there's like 5. I mean, like any, I would tell you that any one of those employers would have been a great employer. And when I was looking at all the offers, I was like, well, I can do all of this other stuff. And I don't know anything about medical devices. This sounds somewhat cool. So why don't I just try this? And so it turned out that I went to Abbott, I went to MediSense, which was their diabetes division, and just loved it. I mean, I think there's a couple of things that makes medical device development and products awesome is one, they are incredibly challenging in that they have to be perfect every single time. If like your device gives the wrong number, you can kill someone.
Yeah, exactly.
Right? It's
very delicate.
Every aspect of it, right? Like I've done systems for women's health, for like ablation systems. I've done, like feeding tubes, endoscopes. I mean, you name it. I've touched quite a bit that's out on the market today.
The challenge of making something perfect
has to be perfect, right?
Yeah.
It's like, or frankly, you could permanently damage someone or kill them. And so
you can either make a massive change or you can make a massive mistake.
Yeah.
Is that something that scared you ever?
No, but I'm just wired, to like, I love that challenge, right? I mean, that's kind of like my philosophy again, is I will strive for perfection, right? In every aspect of basically anything I touch, right? I don't go after 100 things, just to be clear. I focus energies into a couple of things, and then I try to do it better than anybody else could possibly do. And I take great pride in that, right? Yeah.
Has that taught you that sometimes your best is not enough? Because sometimes with these medical devices, because they have to be perfect, I'm not sure if you go through clinical trials or not, but when you do those trials and you understand that your medical device is not up to par and it could actually kill someone, is that actually taught you in other parts of your life that sometimes your best is actually not enough?
Yeah, always. I mean, you're always striving to get better, right? I mean, when like you go to clinicals, you get data that is not going to be, is saying it's not safe to launch, right? I mean, I had that with one client in particular where they were trying to strong arm me in it, and I refused to sign off on it, right? And that was fine. It cost me that client. I didn't care, right? But yeah.
Okay. So let's go back to Edge Surgical Incorporated. Tell me more about what the particular device is, and of course the medical process. Because for every single medical device you've created so far, you'd have had to actually understand the medical process itself to understand that gap and really make sure you're adhering to what the doctor needs or what the surgeon needs.
Yeah. So in terms of the device itself, it's a very simple device. It's a digital ruler. So we are addressing the plate and screw market. Okay. For example, very simple. Let's say you're on a motorcycle, get into a accident. You shatter your let's say you shatter your leg, right? And like you got to have plates and you got to have screws, and they just screw you back together, right? And And so basically what the device is used for is the surgeon will drill holes into the bone. They have a plating system. Now the question is, what size screw do you need? That's really what the problem is. And the technology that's being used today is a antiquated stainless steel device that the manufacturer will supply it with their plated screws. They are incredibly hard to clean. They are very hard to read, and no one likes them. The surgeons hate them. And in fact, the founder or the inventor of basically this device, which looks like this. I'm not trying to do this, but this is what a digital depth gauge looks like, right? Was a hand surgeon, and he was trying to get the back of the bone, try to make a measurement. He couldn't get it. The hook was dull, and he took it. The story is he chucked it across the room and says there must be a better way to do this, and then hence the technology, the invention by Dr. John Kim came to fruition, and then eventually, after that resolution took it, we developed it. The previous founders launched it, and then Actimed came in, funded it, and now we're taking it to the next level. Right.
Love it. So, from your experience from your previous company, how do you plan to brand and go to market with this?
So the device is currently on the market, right? And really kind of talking about your value proposition and so forth. I think the one thing I will add about the value proposition for Edge is that these devices, the depth gauges, are very hard to clean. Okay. And the consequence of that is it is not uncommon that when someone is in the OR and they're knocked out and they're going to get put back together, or they have a bunion, or they have a sports injury that requires a plate and screw, that a dirty depth gauge is in the OR and it could actually be used on you. Okay. And if you go talk to any orthopedic surgeon, you go talk to any of the reps, I don't care who they are, the Synthes, the Zimmers, the Strykers, Smith and Nephews, they will tell you there are dirty depth gauges that SPD has a hard time cleaning them. It's next to impossible, right?
Yeah.
And you will see in the news, I think it was in Colorado, one of their top hospitals had to shut down any of their elective surgeries, I think about a month ago, because SPD could not clean their devices. So this is a real problem. It is a unspoken.
They shut down the whole operations.
Yeah, for any elective surgeries. It's in the news. Go to the Denver papers and search it. You will find it. And that's the same thing in Tampa. It's all over the country. This is a real problem. SPD's having a hell of a time trying to clean them, right?
Yeah.
We have one hospital, I can't mention names, obviously, that had reached out to us because they had 2 dirty depth gauges enter the sterile field, and one of them was actually put into the patient. So that means somebody else's bone chip or blood or whatever from a previous patient, even though it went through sterilization, a dirty depth gauge was used in a patient. And so this is really the need that we are trying to address, right? And so how are we selling this? Well, currently we have the 65 millimeter, right? Which is like your general depth gauge. We are launching the 120 millimeter and also launching the 40 millimeter depth gauge, which is we're going to launch in the end of Q1, early Q2 of 2026. And then at that point, we are going to be going to every single hospital and basically saying, we can drive your risk of infection due to dirty depth gauges to 0, because these are one-time use, disposable, clean devices that can be used so that the orthopedic surgeon can get a digital reading. So it's easier to read. It saves on screws. It saves on OR time, and also is safer for the patient. So it's a win-win.
It's disposable, right? So what's the cost per?
So our average selling price is about $315 per unit. The depth gauge is incredibly accurate and so forth. So really, when you do the value proposition, it's actually costing the hospital, excuse me, more money not to use the device than to actually use it. When you look at the wasted screws, OR time, and the fact you're radiating the patient with additional fluoroscopes and so forth like that, we actually are saving the healthcare system a ton of money. And also in some cases, when the surgeon puts the wrong screw in, the patient's getting billed for it. Okay. Wow. So not only are we saving the hospital, but we're also saving patients.
Also, saving the hospital from shutting down operations potentially from that
Think
particular
about that.
scenario as well,
Right. Right.
which is bleeding money. That's
Is
bleeding money.
bleeding money. Yeah. I mean, and then think about it this way. If like you have just one patient that gets a secondary infection from a dirty depth gauge, how much is that going to cost you relative to a $300 insurance policy? Right.
Yeah.
It's
That's
so
quite a
right.
there.
So kind of to answer your question, how do I go out and promote sales, right? Our sales today, I took over Edge in May. So I don't know, what's that, 6 months or something like that? Our sales have grown about 1,000%, right? And I anticipate we will like probably double or triple in the next 24 to 36 months, right? And frankly, our customer base is only getting stronger,
Okay.
Yeah.
Well,
And so,
I can assume if you're solving this kind of problem, this length of a problem of possibly shutting down operations and preventing infections and actually having something that's usable in the operating room at the time that it's needed, then I think that it should, I mean, by definition, my first principles, it has to be viable. So I absolutely believe that. Now let's go ahead and move this conversation to a little bit more about you, Leo. And the first question I have for you is, what is something about your life that you wish more people knew about?
I don't know. You're talking to the libertarian. I guess, I don't know. I mean, like in general, I mean, I'm very comfortable with who I am, right? I'm not trying to be anyone or anything that I'm not. I take great pride in the fact that, I'm very family orientated, take great pride of my Greek tradition, heritage. And I just love being around people. I mean, it's just, pretty simple guy. There's not there's not a whole lot. Yeah.
Can you describe the 20-year-old version of yourself?
Oh God. I don't know. I mean, you're talking about, let's see, 20-year-old version of me was very, when I was 20 years old, I was a little bit hell on wheels, right? I mean, it was, I play hard, work hard, Marine Corps, run around, have a great time, right? Probably not a whole lot of focus. I can say unequivocally and unapologetically, I definitely enjoyed my youth, right?
Yeah. Okay. Well, is there any particular lesson you learned from the Marine Corps? Because one of the things I've learned about you so far is that you're in a particular field where you could either completely fail or you can completely succeed. Now, a lot of people are not willing to take those kind of risks, but what has opened you up to that? Was it the Marine Corps, or what do you think it was for you?
I would tell you that the one thing that the military does do, and I don't care which branch you pick, it is, I think depending what you put in is what you get out. And what I will say is that perseverance, discipline, you can't be an entrepreneur and you cannot be a successful entrepreneur unless you're willing to risk it all. Okay, so the concept of failure to me doesn't really even kind of go into my head, right? It's not part of my day-to-day thought process. It's not like I say, oh my God, if we don't do this, we're going to go out of business or something like that. To kind of put it into perspective, when I did Resolution, I bet everything, including my house, to make that a success. Yeah. Okay. And I never at one point did my wife ever question it. And nor did I ever think for a second I wouldn't be successful. I just did everything that I needed to do to be successful. And so, when I wake up every morning and I think about Edge, it's like I think about what I have to accomplish today to basically make Edge a success, and it's baby steps after baby steps. So, maybe it's what I can tell you about the Marine Corps, maybe in military in general, is no fear, right? It's
Yeah.
like you really have to say, this is basically the objective. This is what you have to do, right?
Yeah.
And then you're plotting that course to get there. And that's how it's worked for me, right? I mean, that's what.
Incredible point about being fearless, because you could have all the intellect in the world, but if you don't use it, if you're too scared to use that intellect to start a company or solve a problem, then how useful is that intellect, right? So I think that was a really important observation you just made there. So what I'll do now is just briefly provide a perspective on fitness and health, and then from there we can move on to Leo's next year plans and conclude the podcast from there. The
Yep.
perspective I really want to share to you regarding fitness and health is actually just challenging the process, being process-driven individual. If you ask the average person how, if they were tasked with the objective of making a physical transformation, a lot of individuals believe they have to go to a gym or they have to go to a studio and exercise to make that happen. The issue with that perspective that is that a lot of my audiences are entrepreneurs, there's executives who are packed calendars. So not all of them can adhere to that routine, especially on a long-term basis, especially for those who travel. But if you really look at the process and you challenge the process of what drives a physical transformation, it's actually negative energy balance. And what that simply means is you get the right amount of movement and the right caloric intake. And with that, you could actually make a physical transformation. But now that we diluted that to two core requirements, which one takes the time, right? It's the movement. So how can we do that in the most time efficient way possible? I think leveraging something that's location independent is something you can do while you're taking a phone call is going to be the most effective way possible. And the particular movement I'd recommend is leveraging something like step count. Because while you listen to this podcast, while you're taking a business call, while you are essentially potentially talking to your family as well, you can be doing the very thing that is responsible for your physical transformation. And as long as you have ground underneath you, you can also do this as well. So it doesn't matter where you are, doesn't matter what you're doing, you can be able to multitask doing this essentially. And the last thing I'd say is also, if you just get 10,000 steps, that's absolutely not enough. You obviously have to have the right nutritional strategy. And the main thing I just wanted to say is challenge those requirements, understand what it is, understand the process, and you can find out ways to actually adhere to the requirements and succeed. And this is actually what I used to lose over 70 pounds myself. So hopefully that was valuable and gives an idea of how, if you challenge the requirements, you can adhere to it in a very effective way. So with that, we'll go ahead and move on to Leo's next year plans. And tell me more about what's in store for you next year.
I'm just gonna tap on to one real quick thing, and I know we're on a time crank, but I completely understand what you're saying there in terms of your health and fitness. Without your health, you have nothing. And myself, I went on a transformation journey about 2.5 years ago. I was about 260 pounds, but what I did was I fasted. And so I am an avid faster. So, but I exercise, I walk every day for 4 to 5 miles. And it's totally awesome. So congratulations on that, because your health journey is great. So
I appreciate that.
So and then on to 2026. Well, what's going to happen for me for 2026? From my venture capital firm, my business partner and me will probably make 2 or 3 more significant investments into the medical device space. We have a specific criteria. And then obviously we're going to launch the remaining 2 depth gauges, and we're going to start to make Edge Surgical a powerhouse when it comes to the orthopedic plated screw.
I believe it.
Yeah. And then at some point we will be setting this company up so that we will be ready to exit. And I got to tell you, Dr. John Kim's vision of basically what is the right depth gauge for the orthopedic plate and screw market was spot on. And so I want to make that a true, I want to make that real for him. So good guy.
Well, where can people contact you and learn more about Edge Surgical?
Oh, sure. If someone wants to reach out to me, feel free to, you can reach out to my assistant, Emma, and you can reach her at emma@edgesurgical.com. And
Excellent.
For those that would like to just call her, you can reach her at 781-345-0067.
Excellent. Well, Leo, it was a pleasure having the podcast, and it was a pleasure
Thank
to
you.
learn about your story and of course, what you're doing at Surgical and all your success. And thank you again.
Appreciate you. Take care.
Absolutely. This was the Apex Perspective podcast. Thank you for